this country, we do have screening available for bowel cancer, which is really good news because that is another tool to help us identify changes early on. Can you tell us a little bit about the screening?
So screening is normally every 2 years for everyone in this country from the age of 60 onwards. Many people are offered it at 56 as well in most areas, and you have it every 2 years. And what that does, it's not a test for cancer, but it's a test for the presence of blood in your poo. And that's an important thing to recognise, because even if it comes back positive, the vast majority of people with a positive test doesn't mean they've got cancer. It just means there's blood in the poo. And remember, the commonest cause for blood in the poo isn't cancer, it's hemorrhoids and other things in the bottom. So although people might think, oh, I've just got hemorrhoids with bleeding, you might be right, but you want to be sure and you want to make sure that there's nothing else worse than that. And so that's why we encourage the test to happen. Now the new test, something called a FIT, which stands for fecal immunochemical test, is a really accurate way of picking up the presence of microscopic blood in the poo. So remember, when we're looking at the poo, sometimes you don't see it, it looks normal, you know. Some people look at their poo more than others, as we know, but people generally might not see anything, but the test will pick it up at a very sensitive level. If it comes above a certain level, and that number's 10, above 10, then we would want to investigate with something like a colonoscopy or something like that.
And I wonder what your thoughts are. As a GP, I sometimes will ask patients about their poo, particularly, you know, have you had a change in bowel habit? Have you noticed any blood in your stool? And often patients will say, well, I don't look at my poo, and almost seem quite embarrassed. We need to change that, don't we? Because we need to look at our poo.
I mean, generally people are quite embarrassed to talk about these things, aren't they? I mean, you know, who wants to talk about their toilet habits? Nobody does, really. And so I think to raise that awareness is really important. And particularly in younger people, I must say, something like 6% of people with colorectal cancer are under the age of 50. So I think raising that awareness in all generations is really, really important. People justify the symptoms to themselves, don't they? They say, oh, it's this, it's that, or I ate something funny, and all sorts of things that you've heard hundreds of times before, thousands of times before, as I have, that you justify it because you don't want it to be those things. So you make up something, oh, it's because I had something funny to eat, or I've got piles, or you say all these things, but actually having that awareness to say, you know what, I can't look at somebody and say, you've got bowel cancer. You know, none of us can. No. So what we have to do is say, well, there's an index of suspicion. You might have it. You might not, but it's definitely worth investigating and finding out whether you do or not.
And the really important reason why is, well, if it's not bowel cancer, that's reassuring. You don't have to worry about it anymore. But if it is, finding it early means the chances of curing it, essentially, are so much higher than if you know, leave it for months to get worse.
Yeah, definitely. Explain to people, it's not that bad, the whole process of diagnosis, of coming to the answer. People are very scared of being examined or having tests that they might perceive to be difficult or painful. But if we can, I suppose, make them feel more at home with us as clinicians and don't feel we break down those barriers between us, I think that's really important generally, not just for bowel cancer, I think across the board.
I agree. Coming back to screening, I've actually got one of the little tests here. I thought it might be quite nice to demonstrate just how easy this is to do. So these, if you're eligible for screening, then people receive one of these in the post. And it's so simple. All you do is, when you've had a poo in the toilet, before you flush the toilet, take out this little stick, and the end of it, you just get a little bit of poo on the end of it, put it in there, flush the loo, put it in an envelope, send it off, and that's a screening test done. But it surprises me, I'm looking at statistics here, it says just over half of people, 58% in England and 56% in Wales, who receive the screening test, complete it. I look at that number and think that's very low.
Remember, people, if they haven't got symptoms, they'll think, that's not for me, I'm all right, thank you. It's only when people have symptoms, they start seeking medical advice. You're talking about people who are asymptomatic on the whole, aren't you? So people who might have blood in their poo without realising it, but they've got no change of their bowel habit, they've got no pain, they're all right. So what most people think is, if it ain't broke, don't try and fix me, I'm all right, thank you.
And I think that's an important distinction to make, isn't it? Screening tests like this are designed for people who don't have symptoms to try and pick up, in this case, any blood in the poo at such an early stage before it's even given symptoms. If people do have symptoms, don't hang around waiting for this. go and see your doctor
Exactly.
straight away. This is not the test.
Exactly. So if you've got bleeding and you've seen it, that trumps this, doesn't it? Because you've actually seen blood.